GDPR is coming in basically because the previous legislation, data protection, was really out of date. And given the advances we have in technology and the ability for organizations to capture huge amounts of data, that's really driven the whole GDPR. I think it's making them think a little bit more seriously about the data that they're capturing. So one of the areas it will affect is when it comes to sensitive data. So categorization of data, ensuring sensitive data is encrypted, so it's secure, and also securing that sensitive data to only those people that need to have access to it. So workers need to think about, particularly when they're filling in free text fields, so it could be incident or hazard observation form, that they're not inadvertently putting sensitive information like somebody's name into that field. And hopefully their processes are going to have their kind of checks so that the EHS manager can see and they can redact that data if need be. That's a really good question. So absolutely, from an occupational health perspective, you need to hold on to records for 40 years. That doesn't change. What does change is organizations need to think about the policies that they have in place. So you need to justify why you're holding on to that information. It shouldn't be too onerous for EHS staff to ensure their GDPR compliance. Having said that, they do need to go through it and they do need to have a reasonable understanding of the legislation to ensure that they are compliant.